Hey, this is Sportsslaw with Lomas Brown, the pro.
And Deb Schneider, I'm the prof. And together, we're the pro and the prof. So welcome to episode 22 of Sportsslaw. We are, Lomas, you've got your Gator gear on. Doc, you've got your Texas gear on.
We're feeling collegiate today. Feeling pretty.
Yes. I feel like I should have put on my Stanford shirt. I'm going to have to. Next time.
You must have not got the memo.
No, you never tell me anything. So we're with Dr. Rodney Rohde, professor and chair of clinical laboratory science at the Texas State University, and our epidemiologist extraordinaire. And obviously Lomas and I, and we've got all this stuff that's happening with COVID right now, and it's completely affecting how sports are. We've talked with Doc R 3 or 4 times before, and we just want to continue this conversation because there is so much going on. I think we're learning a lot. Mm-hmm. And I guess my very first question, I'm just going to jump right into it. And Lomas, interrupt me anytime. But I was reading today in, I think, the Wall Street Journal that Dr. Larry Brilliant from California, epidemiologist, says this is going to be with us for years. What's your thought on that?
I think that, again, remember, just for your audience, that coronaviruses are the cause of common colds. We've had these things around us for decades and decades, if not centuries. So, in general, I think this particular new novel virus, the SARS coronavirus 2, will probably be around for years and years. I don't know if it'll be at the level we're dealing with right now, just for one simple reason. When a brand new novel virus comes into the human population, so it jumped probably from an animal reservoir into the human population, the collective global immune response has never seen it. So our bodies, no one has ever seen this virus. So that's pretty easy to predict, kind of this wildfire spread that's been going on across the world. Of course, at different levels in certain countries because of control measures and the things we try to do to combat that. But over time, and this is where it's hard to predict, I would guess 1 to 2, maybe 2.5, 3 years, when we start reaching immune levels in the general population, that kind of epi curve will start coming down. And let's hope and pray that one day we're looking at this as like, maybe an annual thing that we deal with, but we have a vaccine and the mortality is really low. And it's just something that we don't even hardly talk about anymore. Like we sometimes don't really think about the flu virus until it's a bad year. I think it'll be around a while at some low levels. Viruses really don't go away. If you look historically, the only real virus we've eradicated is smallpox due to global vaccination. And we could go on a whole conversation about that. In the current global geopolitical world we live in, I can't even imagine having a success of something like the smallpox vaccine, which took a global collaborative effort. Can you see every country in the world right now cooperating for this? I hope I'm wrong, but I just think it's going to be harder because of politics, because of wars, because of you've got to get out there and hit every population, every village, every little town, and that's going to be difficult to do, I think.
Yeah. Doc, last week our guest was a nurse, and she's been in pretty much every field that you could be in nursing. Mm-hmm. From critical, she was saying, to the ICU, to every field. And my question to her was, are we going to be able to handle this next surge better than we handled this first surge? Will our doctors, will our nurses be more prepared during this second surge that they said we're going to get than we were during the first surge that we just going through, or maybe we're still in the first surge?
Yeah, that's an interesting question for sure, because what we hope is that we have learned some things, and again, I'm not a patient caregiver. I'm in the laboratory and in the epidemiology world, but from what I understand and everything I've read and listened to, We've definitely come up with some great measures. For instance, we now know that if we put patients on their stomachs instead of on their backs, that helps more with the respiratory and the clearing of the lungs. We know now that we have, in fact, since we've talked last, I think, we now have a steroidal type of treatment that helps people get off of those ventilators quicker if they're that serious, as well as an antiviral that's working relatively well to shorten that time frame. Still not at a vaccine yet, but we certainly have put some more tools in the toolbox. I always talk to people about when they ask those types of questions, there's really two kind of major things to think about. One is, what have we learned as humans, which we just talked about, but then what has the virus learned? So what many people don't think about is a virus, especially RNA viruses like this, or influenza, or HIV. Unfortunately, they're always a step ahead of us when it comes to evolving and mutating. I can't predict that any more than you can, but we do know they like to adapt to medications. I mean, there's now HIV resistance to certain types of antivirals that worked really well in the beginning. And so we have these issues sometimes where the virus is just a little bit quicker at adapting. And so as humans, we have to respond to that, much like you do in a game, right? You may have to change game plan at halftime. And I would consider this kind of halftime coming up. We're really in the first wave still. Some people confuse what's happening right now in the US to a second wave. It's really just the same wave, but we've had some surges due to various countermeasures. The second wave, if there is one, would probably be after Christmas, kind of moving into the spring, like we saw last year, like coming in that early spring, late winter time frame. So that would be, is something changed with the virus? I hope not. Hopefully we'll still be dealing with the same virus and kind of have learned those measures. But I think we're going to have to buckle up and be very prepared for adapting along with what we see in real time.
Wow. From a science standpoint, I think talking about the fact that the virus will mutate is really a big deal, because like with the flu shot, correct me if I'm wrong, but we try to guess which strain we're going to be getting every year. Right. It sounds like we might be in for the same thing with this COVID.
Yeah, it's really hard to predict. So yeah, great question. Yeah. This is a great question for everyone to kind of think about, because this is a common misunderstanding in the general public, even around influenza vaccines. So let's just kind of talk about that for a second. Every year, usually in October through about March or April, we have a seasonal influenza kind of spike. Mm-hmm. And now we can get flu in the summer, but that's a little rarer. So it's kind of a seasonal virus. And what the United States does through the Centers for Disease Control and state health departments is typically you're sending in isolates, that's different specimens from different human beings around the country, to the CDC. And then they type. Okay, when I say type, they look at the RNA and they see if it's primarily one or two strains. Another kind of the science term for that is a genotype. So it's a unique genetic fingerprint for a particular virus. So kind of keep this in mind. They're looking around the country and around the world, and they're trying to predict, usually in March, April, May, kind of the end of the flu season, what is circulating in the United States, what is circulating in the world, different regions of the world, and then that information goes to vaccine makers. And what they're trying to do is predict what's usually at the end of 2020 or 2021, kind of in that time frame. They're trying to predict for next year's season of flu strain. Now, what happens is sometimes they get it right, and sometimes that stinking virus mutates to a level that they're not expecting, and that's when you hear all the, it doesn't work, or it's only working 50% of the time. So that's kind of just a quick basic 101 and what happens every year for flu. And when people get kind of upset or frustrated that the vaccine's only 50 or 60% effective, wouldn't we like to have that right now for coronavirus? That's my response. Yeah. I mean, I'd take 60% now. So it's the virus is so tricky and so just set up to adapt like that it's very difficult to ramp up. Say if we found out right now that coronavirus was going to be different in 2 years, do we need to tell all the vaccine producers that they're going to be wrong in predicting? So we have to go with what we have. And what may happen is when we develop this vaccine, when that day comes, we hope and pray again that, maybe it's 60 or 70 or 80% effective. And that's going to be good for what's happening. It's really difficult to get 100% efficacy out of a vaccine. I mean, it happens occasionally, usually with DNA-based viruses that don't mutate as much. But, again, 60, 70, 80% is going to be great. It's better than 0% that we're dealing with right now.
Wow. I think we just went to epidemiology 101.
Sorry. I mean,
no, that's fabulous.
It's really a great question because this gets even into the vaccine, anti-vax kind of world and things like that, which is really unfortunate nowadays. My grandmother, who passed away at 100 years old, we used to talk about this before she passed away, that she couldn't believe when people wouldn't take a polio vaccine. I mean, she lost siblings in childhood to this stuff. And it's like, that's a whole nother conversation. But, vaccines are here to protect us. The experts and the physicians and the research scientists that work on them are doing their very best to make them as safe as possible. Unfortunately, we had some bad press around this with the MMR vaccine, which has been retracted from a particular scientist who's lost his medical license and other things around this. In general, vaccines have side effects, and sometimes you might have a bad side effect, but in general, they protect the population almost without fault. But like with any medicine or with any treatment, there is some risk. But in general, it's going to be a great thing if we can get a coronavirus vaccine up and running to protect our population. I mean, I'll be in line when that thing is ready to go. And they're already starting that, as you might have seen on some of the announcements. They're starting to do phase 3 clinical trials, which is, I really applaud the world for pushing that along. It's way ahead of schedule. They've really tried to cut out the red tape and all that sort of thing. So let's hope, in a year or so or less, we may be having some targeted vaccine campaigns going on.
So, Doc, let's do a little role playing if we can. Let's just say right now, I'm an active athlete in the league right now in the NFL, and you're my personal doctor. And I come to you and I tell you, we having a personal conversation. I'm sitting in your nice, good-looking office, looking across from you, and I'm telling you, Doc, I'm nervous. I'm scared about going back out there this year. Should I stay in or should I opt out? I got a family, I got kids, but I got younger grandkids. So what's your opinion? What should I do, Doc? I'm at a crossroads in my career. This is like my 10th year in my career. I got a contract year coming up soon, but again, what should I think about doing? I don't know about this virus. You start saying all this stuff about this virus. What's your advice to me being my doctor?
Right. Great kind of scenario to think about in the world of athletics and really even schools. I mean, these are the same questions that faculty who are 65, 66, 68, 70 years old with diabetes or other comorbidities are asking administrators. It's the same thing. I think what I would do if I was your medical advisor in that case is I would first assess your health. I would assess your health and see if you had any major risk factors. I would talk to you about what you just said about family. Do you have, I was watching some news last night about South Texas, which is under kind of a big surge in this virus right now. And in those families, they have 3 generations living in one house. It's just kind of a truth in that area with cultural and kind of the norms there. So they have grandchildren, parents, and grandparents all living in under one roof. That's a little different than if you're living with your wife and maybe you're alone and you could limit some of your interaction. So I'd be curious as to what that situation was. And then, just like I do with my students or faculty that come to me with these questions, it really is going to come back to a self-assessment by yourself in regards to, can you even perform on the field? Can you perform in the classroom if you are so anxious about your health or the health of your loved ones? Then maybe you take a gap year, maybe you step out, or maybe you work with, now this is a little different because maybe I can offer hybrid classes or online classes or things like that. Sports, it's such a difficult question, because let's say you're in that 10th year and you're trying to have the best year of your life to get that next contract. You know more than I do. You step away from that field for a year, you may lose a step. You might have some accident where you hurt yourself and you can't play while you're training or something like that. Those are questions that I think gets to the the marrow of the situation. Is is it going to be up to management and the team to give you a paycheck and a year off if you're really, so maybe the professor here can talk about this. Does it get into legal situations where what's fair for Lomas versus his teammate who's willing to go out there and do it for the team? Well, that alone already puts stress on you. Like, are you a good teammate? Are you going to come and play because of this virus? But ultimately, as a friend, a colleague, a medical advisor, I would tell you to do what sits right with your heart. As I talk to students and parents, because I know as a parent, I would be worried sick, even though my 20-year-old would probably be like, I'll be fine. I would be worried sick to send them out into that environment if they weren't doing everything they could to be safe. Tough question.
I think that's a really, really great question, though. So many pieces of that from the legal aspect and from what this is really one of the first times we've seen such a like a pandemic, which is affecting athletes as well as coaches and management and family. I mean, it's affecting the world. And usually it's, okay, the athlete got hurt or the athlete has the flu or the athlete's sick for a couple of weeks. One of the things that I was reading is that there are some people who are fighting these symptoms, and we're not talking about 2 weeks. We're talking about 100 days.
Yes.
That it's a long term. And a lot of these people are not the older folks. They are the people that you think would have no pre-existing conditions. And I take that back to the athletes. What is really the prognosis for an athlete who gets the virus and who plays?
Yeah, I think, that's again, kind of an interesting scenario, because I've been dealing with these more and more. I was consulting with let's just say a friend of a friend who couldn't get back to work because this person was in their 40s, early 40s, and they kept turning up positive with kind of the gold standard molecular test. 28 days, this person. So he was getting tested about every 5 to 7 days, and he needed to get back to work. I mean, this was a paycheck issue for him, a kind of middle America kind of guy. And, I kept telling him as I was talking to him, maybe, and what he finally did was, and I don't know if you guys have seen the recent CDC recommendations. Again, so we're learning as we go. There are some situations now where we're seeing people stay positive because, and again, getting into the weeds a little bit, these viral nucleic acid tests will pick up any amount of viral RNA. So that doesn't always mean you're infectious. So there's kind of a gray area here that gets kind of difficult and complex when the public starts, having these questions, but they're great questions. There's windows. And so, we kind of keep using these 2 to 14 day incubation or infection period, and you might have it a little before that time and a little after. So I'm always kind of talking to people about, maybe 20, 21 days to kind of be careful. But what about the people, Deb, that you're talking about that are turning up positive with maybe different tests even, 28 days, 35 days? At some point, people are, and they feel fine. So, you were talking about people that may still have symptoms, but there are others that are feeling great. They're asymptomatic again, but they're turning up positive. So kind of flip the scenario a little bit, but similar. Do you let them go back to work when there's a positive test? That's a tricky question. And then the same for maybe you're turning up negative, which I've seen some of this turn around too, but they feel like something's still wrong. They're fatigued. They're kind of have weird symptoms, all of a sudden they have nausea and diarrheal symptoms, 40, 50 days out. So I think we're still learning about the pathogenesis of the virus and why certain people are kind of entering that phase. And I haven't seen really anything concrete yet in the literature that we really know truly why that's occurring. It's something to do with how the immune system in one person reacts versus the other. And again, so many variables. This is frustrating for people because, physicians and medicine should know this stuff, but sometimes we don't. We just don't. I mean, we just don't know the answer sometimes. And
it's science.
It's science. Yeah. We're doing the best we can, and it's kind of moving along. So those are the cases. Again, from a legal standpoint and a personal standpoint, I don't know what you tell a person.
Well, you know what? That brings up an interesting point, Deb, and you know where I'm going to go with this. With Matthew Stafford.
Right.
Brock teed it up perfectly.
Right. Now, you're saying there's different incubation periods and different things. You understand what happened with his false test.
Right.
Now he's taken 3 tests that have read that he's not, that he's been negative. But my thing is just like what you're saying, Doc, they really, really don't know. How can you have one positive and then you come back with these negatives? For me, I think the biggest thing has to be Matthew around Kelly and those 4 young kids.
Right.
At the age of 5. Not more so Matthew, but I think the emphasis has to be on his young family, Kelly having the brain surgery a year ago, and these young kids under 5 years old. So, I mean, are the Lions in line to maybe be negligent towards, because they brought him back. They said he could come back to the facility.
Right.
Maybe Deb, I don't know. Maybe they might be negligent. I don't know.
But he had 3 negative tests after that.
Right. And all the family tested negative as well.
And right. So how good are these tests? I think that's
exactly the question. That's exactly the question. And so and maybe you'll speak to the legality of this later, but what's tough about this is I read that post, again, it kind of hurts me personally because I'm such an advocate for the medical laboratory and laboratory medicine in general. Mm-hmm. However, having said that, if you look at any test, including rapid flu tests and things like that, where they stick it in your nose and you get a color change, or even pregnancy tests, these are all kind of similar types of tests. And even the gold standard tests, like the nucleic acid PCR test, if you look at the details, which most people don't, if you look at the details of those tests and then their package inserts and things like that, you will look at things called sensitivity and specificity. Sensitivity means, can it detect all coronaviruses? Let's just use this scenario, all types of coronaviruses. So it's very sensitive. Mm-hmm. Specificity is, will it detect SARS-2, a particular virus? And what's the level? So what you really like to see is, 100%. Well, that doesn't happen. I'll just say that you never really see a test that can offer perfect results. But what you do want is 90, 95% in those areas. And some of these tests, especially some of the rapid antigen tests, sometimes they have 20, 30% error rates. So 1 out of every 3, 1 out of every 4 test is a false positive or false negative. What Matthew Stafford's was a false positive. Mm-hmm. Now, here's what's interesting about this. When I talk about this in general before the pandemic and stuff, in some instances, a false positive is the better scenario, because that means if Deb turns up false positive, I'm going to go ahead and treat you or be careful with you. And to me, that's better than a false negative, which means you're going home, you're fine, and you have HIV or you have flu and you're going to spread it around. I mean, that's really the more worrisome to me. But what's interesting with this case is a false positive where we're trying to do our best to protect someone has hurt his family, has hurt maybe his financial situation. It certainly has been, in this case, when you read those posts, it's kind of a stigma issue.
Yes.
Where, like she said, I mean, I can't believe this. Like people are looking at her. She can't come into a restaurant, stay in your car. They're eyeballing you when you walk into the store. I mean, this is sad.
And these
stuff.
are posts from Kelly, just for our listeners. These are posts from Kelly.
Absolutely.
Kelly Stafford, who was very upset. Right. He was very upset.
It makes my heart hurt when I hear that.
But Doc, don't you start getting into HIPAA and all that. And even with Kelly, Rudy Gobert, he was the first NBA player that tested positive.
Right.
Man, he said he received death threats.
Yep.
He was just saying how he was stigmatized. People didn't want to be around him. Look, and I can see that because this has been a deadly disease. Right. Or virus that is going on and still going on. So I can understand Kelly being upset about that because I see some of the looks of people who don't have masks on, the looks people give them. So you can understand her being upset about this. But my thing is, you're talking the NFL. We're supposed to have the best of everything, including testing. And you getting false testing results, that to me, that doesn't sit well either. And I'm quite sure it doesn't sit well with some of the players, the active players in this league too.
Yeah, well, let me throw one other thing in there. We are testing, for instance, in Major League Baseball. We're testing every other day. We're playing every day. So we talk about the best of the best, and we talk about how quickly these tests are coming back. And Matt Stafford has had 4 tests now in a week.
Right.
We've got the Marlins. We've got these teams that are just being decimated by the virus. When should we test? How should we test? There's so many unknowns, in my opinion, as far as testing in sports.
Yeah, there really is. Again, a question I'm not sure I can answer perfectly, but I mean, it's a great and important thing to think about. Again, pre-COVID, I used to talk about if you test for it, be prepared to find it, right? And so sometimes, again, out of context a little bit, sometimes I wonder if we're over testing, but then you get back into that world of, well, we've got to know, these people are all coming together in a team scenario or a school scenario. So again, I'm not sure I know the perfect answer here, but I certainly think, coming back to Lomas's point, are we doing our best around information sharing? I worry for families and players, mental health on top of their physical health when you have these issues where, a star athlete. So it's certainly different than, say, my child is a false positive. Nobody's really going to know that or care about it. But Matthew Stafford, or the Dallas Cowboys quarterback, or, whatever scenario you're talking about, that's a big deal. And everybody wants to know, just like in the world of actors and actresses. I mean, it suddenly becomes social media frenzies and things like that. So I don't know. In the world of HIPAA, Deb, and the world of information sharing, is there something an organization could do a little better? Maybe they're doing everything right, but it just leaks. I mean, what a mess. I don't know how to kind of handle that.
I think the bottom line on this one is that we have laws out there to protect people, such as HIPAA and that. And with this COVID virus, so many of the laws have just gone by the wayside. We're not following, because in the interests of protecting everybody,
right,
we're looking at things completely differently. And, it's like almost anything. The law is going to have to catch up.
Yeah. Here here at the university, we're thinking about this in terms of a classroom setting or a dorm or something like that. So the similar question or scenario you could pose, and our physician here always answers on the side of the law, which that person should, with respect to, it's a need to know public health situation. And if one person in a classroom of 100, say, or a dorm setting is positive, or even if it's a handful, how far do you go? I mean, certainly that person's privacy should be protected, but do you have an obligation as a physician or a public health servant to say, hey, dorm X has had a few cases, and if you would like to leave and go back home for 2 or 3 weeks, we are going to allow that? So you have to kind of think about these scenarios around. It gets really difficult, because then you're worried about them taking it home to grandma and grandpa if they live with them. I mean, there's almost no great answer. Or resources. I mean, how do you separate an NFL team of 50 people and say, okay, this one person might be positive, so all of us are going to now ship out to different hotels or different floors of hotels, and we're not moving for 15 days. And that's people that have financial resources.
Exactly.
What about poor or middle class families that can't do that? It's frustrating. I don't know.
Yeah, I mean,
difficult topics.
You just see, and then just the NFL is changed in college, what they're doing. It's changed in high school, even the way we're coaching the kids and how we have to social distance with the kids, and how we have to get our temperature checked before we can even get on the field, us and the kids, and they have required to wear masks. This is just in high school. So then you move up to the college level, where they got these immaculate locker rooms and training facilities. Right. You're looking at all the adjustments that they're having to make with the distancing in there with guys' lockers and admin lockers. The Lions have done the same thing. You could pull up a video and look at how they've had to bring in so many more lockers and distance guys out, and some of the things they're doing, like tiering players, tier 1, tier 2, tier 3, they even get in the building over there. A lot of us not even allowed to even go over to Allen Park, their training facility this year. They even have rules for us as reporters when we go out there to watch practice now. If we get the opportunity to go out there and watch practice, how we have to social distance. So it's an adjustment, a fluid adjustment that's everybody is having to make. Right.
It's so difficult when you bring those things up. I was Texas State has its first football game on August 29th against SMU. We're going to go to, unless something's changed since earlier this week, we're going to go to 25% capacity in our stadium. So, spreading out. It'll probably be mostly season ticket holders, I would guess. But, and then I struggle with this so much because, we all love sports. And I think about the athletes. So, I played a little bit, right? I'm not quite in the level of my colleague here, Lomas, but as an athlete, you want to play, you want to be a team member, you want to support the team. So there's a little hidden pressure there.
Yes.
Obviously, if you don't say there is, you're not paying attention. There's a little, especially with contracts, right? Yeah, money's involved, livelihoods are involved, and so I really struggle with the question. We've been talking about this for weeks now. Should we just call it off? Should we call things off and protect our student athletes? It's the same question universities are asking about online versus hybrid versus face-to-face. And I guess what I struggle with on being on both sides of this fence is I just know, because it happens, if we're wrong and the virus kind of fades and nothing, then people are going to be so upset that they lost a year. So I keep telling people, I and others like me really can't win for losing. It's a tough call. And all I hope is that we do our very best for safety of the players and the fans and whoever else is around, because at the end of the day, there's so many people that will state to me, mask or no mask, I don't care. It should be my right to play or not play or to go to the store or whatever. And I agree with that to a certain level, but we're talking about a pandemic.
Right.
There's got to be some responsibility personally as well as organizationally. And I'm not claiming I know the right answer for either one of those, but it's a tough situation for people, I think, to make those decisions. And then, like Lomas says, for somebody like me to say that versus a kid coming into school that, he gets a chance to play at Texas State or Florida, and all he wants to do is play, or she. But maybe they can't make that decision correctly because they don't care about their health. They're thinking about their future, and it's a mess. It's a mess trying to think about those scenarios.
I think that's one of the things that we haven't talked about yet. And Lomas, we talk about you're in your 10th year. It's your contract year. But there are so many high school seniors or high school juniors or, sophomores, juniors, seniors in college who are really trying to make the team, get to the next level, get drafted.
Yes.
Olympic athletes.
Right.
I mean, once every 4 years, it's hard to play and to stay at that level.
Right. And it's really hard for us to judge.
Yes.
For me, I'm like, I can't make that decision for someone who's a world-class athlete. I mean, my goodness, I just, it'd be like somebody telling me I couldn't come to work in practice when I kind of feel like I know how to protect myself,
But you're older. You're not 18.
But I would say this too. Though sometimes we have to protect the athlete from himself. We do, because the competitive, like you're saying, the competitive nature is going to come out. You're going to want to compete. You're going to want to be out there with your fellow teammates. But like I say, I think sometimes as an administrator, as someone that's a power that's over them, you have to sit back and look at the whole situation and say, like you, Doc, like they say, we should be hearing from the experts. The president shouldn't be saying what's going on. We should be hearing from guys like yourself, medical experts that are in this field that know that. That's who lead we should be following. And to me, it's the same, with some of these athletes. Yeah, they're going to want to play. But if a coach comes to me and he feels that it isn't safe for me to be out there on that field, then I'm going to have to try to at least have his opinion in my mind when I make my decision about what I'm going to do. So sometimes you have to protect us from ourselves.
Right. I totally agree. I mean, I think I've said this before. I would hate to be the person making these calls. It's such a difficult decision. I respect and support so many college presidents and other administrators, and I do think, I'll say at Texas State, every level I've worked with, and I've sat on work groups at every level now, I feel total due diligence. I feel like people are, really doing their best efforts at thinking about this. And whether it's here or UT or Florida or anywhere else, you're under that, pardon the pun, you're under a microscope. And I even feel it. I get emails with very upset colleagues or students or people like that kind of want to know why we're doing certain things. And all we can do is talk about best practices. We're doing the best for safety. We're following all the guidelines of Centers for Disease Control and WHO and so on and so forth. And then ultimately, hopefully making a joint decision where a student or an athlete or a faculty member or a worker, whatever the scenario is, has input and understanding around their choices. Because again, this kind of comes up. It's still a country where we believe in choices and freedoms. But I think we're living in a scenario that I haven't lived through. I've never experienced a pandemic. I've seen some really bad outbreaks where we, protected people in certain situations. but it's always been close the school down for 2 weeks, and come back because it's back to normal now because it was a bad flu season or something like that. It's never been an ongoing total economic situation, total healthy situation. And so it's just going to be really challenging, I think, for all those factors we've already talked about.
Yeah.
Wow.
I just wanted to ask, Doc, out of all the sports, I mean, do you think football, because of the nature of it, do you think that, and remember, nobody else plays football anywhere in the world but here in the United States. So all the other countries,
Right.
They play soccer as their football. Right. Our football is totally different. Do you think, out of all the sports, do you think football will be able to come back and will be able to make it throughout the season? In your opinion, I know it's hard, but I'm just.
It is hard. Football and rugby, I kind of think about rugby too. I don't watch rugby or anything, but same kind of situation. I do think football and rugby are probably the most risky sport because of that close contact. And, we talked about this before, you're sweating and you're breathing and you're huffing and puffing right in people's faces. I mean, I'm even thinking about in a scrum or when you tackle someone and you're all just piled in there. That's worrisome to me. Unless we find ways to mask that doesn't inhibit performance and things like that, that might be a little different. But it's so different than basketball or baseball or hockey, certainly tennis and golf and things like that. You think you could be way safer. So, yeah, I'm not sure football will be, at a lower risk. I think it's definitely going to be something that the NFL has to consider, ways to protect those players. I think you can do all the things right in the locker room, like you were talking about. I think you can kind of prepare for that. But on the field, and again, it comes back to testing. So how much testing are we going to do to ensure negative players? Ultimately, you can't guarantee 100% negative. In my lifetime, I've never seen it. I would never sit on a jury or an expert stand and state that it can offer 100% certainty. It just can't. No laboratory test is, in my professional opinion, has ever done that over time, especially. So, I don't think you can guarantee a football will be safe if we play normally on the field without protection and some other measures. I just don't. It's going to be riskier than baseball. It's going to be riskier than basketball and things like that.
Wow. Well, our producer is telling us we're running out of time, and I just want to keep talking.
I know. It's a great topic. What's so great about it is it crosses so many sectors. We could be talking about my classroom.
Yes.
It's the same stuff. I sit down every day. I mean, this stuff keeps me up at night. And I do want to stress to the audience that, we're doing the best we can. I mean, we're really working hard around this, and I'm speaking for public health and healthcare and medicine. And I know you guys care, in your professional fields. I just don't know if we know all the right answers, and I just hope and pray that we can find a way around this so that everybody's safe and protected.
Yeah. Any final thoughts? How we go forward?
Yeah.
I mean, I love talking to both of you about this because it's just so fascinating to me. I've got a little bit of legal and I swam. Okay. That's really different than playing professional football, being an epidemiologist. I learned so much in these. Yeah,
and I appreciate it. I've learned a ton as well from both of you. I love getting the insight from a player and a legal mind like yours. I continue to think about, I keep crossing back and forth, and you guys do this to me as well as other interviews or things I'm writing about. I do think we can be safe with the proper protection, like mask and distancing and things like that. So when I'm talking about the general population, it's almost kind of a separate conversation. When you start talking about scenarios like football, I do think we can follow the science and do the best we can, but at some point, do we pull back? Do we stop? In baseball, we had those two teams that had that issue. Do we just go, okay, the next two NFL games we're not playing? I mean, those are questions for owners in the league. I don't know how you stop a season with two teams because they're playing other teams. Again, I'm glad I don't have to make that decision, but I think they should be they should be preparing for it. So many lives are impacted, monetarily and otherwise.
Wow, that's possibly the biggest thing you said. We should be preparing for exactly that scenario.
Lomas, because we've seen the data shows us. Baseball is seeing this and basketball, so it's not going to be perfect. I mean, it's going to probably happen. We're seeing it in classrooms and elsewhere. So you have to think scenario based. You have to do tabletop exercises and think about these things and have a plan, because a plan is better than no plan. Like, people want you to make a decision even if they don't like it. Like, we're doing this. That's been my advice, and it may not be agreed with, but it's a plan, based on science and health.
And I think I have to admit, I might have been wrong about the bubble. I mean, because if you look at it, I mean, the NBA right now, they're getting through it. No cases.
Yeah.
And they're in the bubble.
Yeah.
Baseball's not in the bubble. Football won't be in the bubble. I don't know about hockey. I don't know if they're in the bubble type situation, but maybe that might be about.
Yeah, I mean, I think baseball's done a pretty good job. I think the NBA is doing a pretty good job too. But certainly it's going to be hard to bubble NFL. It's so many more people.
32 teams too, Doc. I mean, the NBA only came back with, I think, 20 or 22 teams.
Right.
In the hockey, they got the teams that are competing for the playoffs.
Right.
So it's like you said, 32 teams, almost 100 players per team, and that's not even counting the support staff.
Right.
You have to have to play a football game or to go out there and compete, just to even practice, not just to talk about a game, just to even practice.
Right. Are we talking about practice?
Hey, speaking of which, did you know that the free throw percentage is now better than it was outside the bubble? It went up to just over 80%. So practice, not having fans heckling.
Maybe
who knows?
Maybe so. Less pressure. Huh?
Okay, so we are out of time here, but we're gonna have to do this again.
Absolutely.
So thank you, Doc, and check us out on sportsslaw.com.
Ray gonna put up practice.
Oh boy.
Are we talking about practice?
Practice. Man. Gosh. Check us out on sportsslaw.com. Check us out on Facebook. Check us out on SoundCloud. And also check us out behind the scenes, because we'll continue this conversation. Thank you, everybody.
Thanks, guys.
Thanks. Wow.
Yeah.
Good times.
Okay, I have two more questions for you that I really wanted to ask. Number one, immunosuppression